Hi, this is Jen Ackerson, and today our focus will delve into the rich tapestry of theoretical approaches integral to addiction counseling. As addiction counselors, we navigate many considerations. We begin by exploring our theoretical orientation, assessing the contents of our professional toolbox, and discerning which orientation resonates with our understanding of human nature while ensuring our comfort in the counseling realm. Moreover, we'll examine the diverse orientations we can draw upon, fostering our ability to adapt to the unique needs of each client presentation. Concurrently, we must factor in the nature of the agency that we serve. Are we harm reduction approach based, or is it rooted more in an abstinence based philosophy? Does the agency champion an integrated care model with learning collaboratives and interdisciplinary teaming? Regardless of the agency's ethos or approach, my goal is that you glean insights from your coursework at Waynesburg University, embracing a trauma informed care approach as you embark in your journey in the counseling field. So, before we really get started, here's a discussion question for you today. What theoretical approach to addiction counseling resonates the most with you right now? Reflect on theoretical orientations you identify with and the connection between your orientation and view of human nature. We need to enhance addiction treatment by integrating trauma informed care initiatives. There are numbers of models that exist that do this exact thing. First, we'll talk about addictions and trauma recovery integration model, which is known as Atrium. This was developed by Miller and Godfrey. This model recognizes that trauma impacts the body, the mind, the spirit, and that there is a mind body connection. So, if you like the body keeps the score, this might be a good fit for you. This model also integrates cognitive behavioral approaches and relational treatment while emphasizing mental, physical, and spiritual health. The program is a 12-week curriculum and is designed for survivors of sexual abuse and physical abuse, those with substance use and other addictive behaviors too, and those who are actively engaged in harmful relationships, or people who self injure or have serious psychiatric diagnoses, and those who act out of violence and abuse others too. So, this trauma informed model integrates a number of approaches to best meet the presenting needs of the clients that come into treatment. And as you just heard, there's a number of populations that serve within the substance use disorder population. Seeking safety is a therapeutic model designed to help individuals, particularly those with a history of trauma and substance abuse, attain safety in their lives. This model is widely used in the treatment of trauma and substance use disorders. And here are some key points about the seeking safety therapy model. So, seeking safety focuses on establishing safety as the primary goal for individuals dealing with trauma and substance use issues. It's an integrated treatment approach addressing both trauma and substance use simultaneously. The therapy model is nonlinear, allowing flexibility in addressing various issues rather than following a rigid sequential order or curriculum. Safety is emphasizes the foundation for healing and recovery, both in terms of physical safety and emotional well-being. It incorporates cognitive behavioral techniques to help individuals identify and change negative thought patterns and behaviors related to trauma and substance use. The therapy is organized into four key content areas: cognitive, behavioral, interpersonal, and case management. It emphasizes the development of practical coping skills to manage triggers, cravings, and the impact of trauma, and thus is highly recommended for people who have co occurring PTSD or trauma alongside their addiction. This model has demonstrated effectiveness in research studies and is considered an evidence based practice for trauma and substance use disorders. The model includes psychoeducation about trauma and substance use, helping individuals understand the connections between the two and how they affect one another. Seeking safety is empowering, encouraging individuals to take an active role in their recovery by learning and applying coping strategies. The therapy can be delivered in both group and individual formats, allowing for flexibility based on the individual's needs and preferences. Helping Women in Recovery is a treatment model developed by Stephanie Covington that specifically addresses the unique needs of women in the recovery process. Adaptations have been developed for use in the criminal justice system, and this also has a second level trauma curriculum titled Beyond Trauma, A Healing Journey for Women. In addition, a curriculum for girls titled Voices. The Trauma Recovery Empowerment Model, or TREM, was developed by Maxine Harris, and there's also a triad women's trauma model that I was able to a free treatment manual for, and it looks like it's closely aligned with DBT skills. So here we're offering three different integrated addiction treatment models that focus specifically on women in recovery who've experienced trauma. And these gender specific approaches are tailored for women, recognizing and addressing the distinct challenges and issues they may face in the recovery journey. They emphasize a trauma informed approach, acknowledging the prevalence of trauma among women and integrating trauma sensitive interventions. They take holistic approaches by addressing physical, emotional, social, and spiritual dimension of women's lives to promote comprehensive healing. And these also encourage empowerment and self efficacy, helping women to build confidence and a sense of control over their lives and their recovery. The Matrix model is an evidence based approach to addiction treatment and counseling that was developed for individuals in the 1980s as a response to the rising issue of stimulant abuse. So, those are things like cocaine, crack, methamphetamine. And now it's used to treat other substance use disorders too. The Matrix model combines various therapeutic techniques and approaches for comprehensive treatment strategy. It follows a 16-week structured format with a manualized approach, providing a clear framework for therapists and clients. Incorporates a variety of therapeutic components, including cognitive behavioral therapy, contingency management, family education, individual counseling, group therapy, and drug testing. Emphasizes both educational and behavioral components to address the complex nature of addiction. Clients learn about the effects of drugs on the body and brain, as well as acquire practical skills for coping with triggers and cravings. Utilizes a positive reinforcement approach to encourage and reward pro social behaviors and abstinence from substance use. This reinforcement is often implemented through a structured system of incentives. Recognizes the importance of family support and involvement in recovery process, and the Matrix model includes educational sessions for family members to enhance their understanding of addiction and recovery. And it focuses on relapse prevention strategies, teaching clients how to identify high risk situations, develop coping skills, and implement effective strategies to prevent relapse. And it's also evidence based. So it's demonstrated effectiveness in multiple research studies, particularly in the treatment of stimulant use disorders. Its evidence based nature contributes to a widespread adoption in addiction counseling. Originally designed for outpatient settings, the Matrix model has been adapted for use in various treatment settings, including intensive outpatient programs and residential settings. Motivational enhancement therapy is designed to address ambivalence about engaging in treatment and discontinuing drug use. It specifically targets discrepancies and ambivalence, fostering rapid and internally motivated change. The key components of MET or MET include strengthening commitment to change, developing a plan for action, enhancing coping strategies, monitoring the change process, and reaffirming commitment to change. So you might notice it sounds a lot like motivational interviewing, and it's because MI is integrated deeply into this model. Motivational enhancement therapy utilizes motivational interviewing techniques to evoke and elicit change. It aims to stimulate discussion about substance use and elicit self motivational statements from individuals in treatment. The therapy involves an extensive co occurring assessment lasting approximately an hour and a half to 2 hours, and it covers various aspects for individuals experiencing substance use disorders or in early recovery, as well as their loved ones. MET has an integrated approach focusing not only on substance use but also on co occurring conditions, and it recognizes the importance of addressing the broader context of an individual's mental health. It's intended to be brief, typically consisting of 2 to 4 sessions, and this aligns with the goal of evoking rapid and meaningful change. And applying assess, motivate, educate, and intervene, or AMEI, concepts is a significant aspect of motivational enhancement therapy. The therapy focuses on assessing readiness for change, motivating individuals, providing education, and intervening effectively. Narrative therapy, developed by Michael White and David Epstein, offers a unique approach to treatment grounded in psychotherapy. Central to its philosophy is the recognition that each individual possesses their own truth, rejecting the idea of a universal truth. This therapeutic method externalizes problems by scrutinizing and deconstructing them, unveiling the oppressive narratives surrounding the issues. By externalizing problems, the focus shifts from seeing the individual as the problem to recognize that the problem is distinct from the person. So, an easy reframe here might be something like if a person says, yes, I am a problem drinker. You might have them reframe that into a narrative that externalizes the problem that might sound a little bit more like, you have a problem with alcohol, or alcohol is the problem. So, in the context of addiction, individuals are encouraged to detach from the problem, reframing their understanding and exploring alternative perspectives. Narrative therapy employs creative techniques such as metaphorical exploration, asking individuals to describe their addiction as an animal or envision recovery through metaphors. This helps in reconstructing new narratives, and engaging in the use of metaphors is a powerful tool in therapy. The treatment techniques associated with narrative therapy aim to separate people from the problem, reduce unproductive conflict, mitigate the impact of failure and inadequacy on individuals in recovery, and open up new possibilities for action. By externalizing problems and adopting an external point of view, individuals gain the freedom to make meaningful changes and choices, fostering effectiveness and reducing stress in addressing addictions related challenges. And there's a video linked below in the module to see a little bit more about narrative therapy in progress. So, as you can see, there are already tons of treatment protocols, therapeutic interventions, and ways to wrap psychotherapeutic models around the treatment of substance use. Additional psychotherapeutic models to consider might be EMDR, somatic experiencing, polyvagal, and internal family systems, just to name a few. And these all require additional training and, in some cases, supervision and certifications to practice, but they can be widely beneficial for treatment, especially considering the co occurring trauma that most of our clients are experiencing. Some other treatment techniques to include are contingency management, and that's a behavioral treatment based on operant conditioning principles. So, most commonly, the treatment provides something of monetary value to clients to incentivize them not to use drugs or to participate in parts of their treatment plans. So, for instance, upon confirmation of a urine drug screen that's negative for non prescription drug metabolites, clients might earn a chance to receive a prize or a gift card or spin a wheel and receive a prize. These principles behind contingency management are intuitive given what's known about the neurobiological basis of addiction. Drugs hijack the brain's reward system during prolonged periods of drug use. Monetary reward as a part of contingency management that's tied to abstinence or other treatment objectives provide competing reinforcers. Addiction recovery apps offer a simple way for clients to receive treatment virtually, and usually these are used in conjunction with regularly scheduled in-person treatment. Some of these apps guide people through treatment using a specific approach, such as a 12-step approach, while others allow individuals to interact with people who are also in addiction recovery. Some apps make it easy for people to track their sobriety, such as how many days they've been sober, and allow them to share this information with supportive family or friends or an accountability partner or their treatment team. And other apps focus more on stress management and motivation through meditation and other techniques. There is usually contingency management built into these to reward for time spent on the app. And Allegheny County just released information about a partnership with an app by Dynamicare, where the county will offset costs for eligible clients. And there's others available too, like Reset and Reset O, that can be billed through insurance. Finally, I'd like to offer you some resources. We talked about a number of different types of models that you might not have been familiar with outside of the variety of theoretical orientations that we do know. SAMHSA is a great resource, Substance Use and Mental Health Services Administration. They offer what's called tips and taps. These resources are free. You can download them or order them online, and there is a wide variety of treatment homework and treatment assignments listed within these types of manuals. But most importantly, it provides data, research techniques, and interventions for all these professionals in the field, and they update each tip about 10 years to make sure that the information is current and relevant. You'll see a great number of topics. One is about enhancing motivation for change. There's some about the special needs of women in recovery or people in recovery who have chronic pain. You'll also see on this page under the substance use disorder treatment for people with co-occurring conditions, they have unique specialty topics for pregnant women as an example, or medical conditions such as TB or hepatitis C, things that we face when we're working with addiction counseling that people have experienced and are trying to heal and recover from. Also, when talking about criminal thinking, there are a large number of resources available from the Change Companies. Change Companies provides curriculums to utilize like responsible thinking or courage to change. I would encourage you to take a look at the wealth of resources in the field. This is a brief introduction as to what you might be able to use in the field. And please know that these curricula, some of which are free, like the tips and taps from SAMHSA and NIDA, And there's also a ton of free resources out there from taking the escalator or therapist aid, but there's some curricula that come at a hefty cost. The new direction curriculum, the matrix curriculum, which I talked about earlier, they come with a pretty sizable fee. So sometimes you have to go back to the agency to see what you have money for, what kind of expense they can afford that you can use. And also be mindful of copyright protocols and not being able to copy portions of curriculum and provide them as handouts so that you're not infringing on any copyright rules. With that being said, this is an overview of just some new addiction integrated models that you might have been aware of, you might not have been aware of, as well as techniques to incorporate into your work that can enhance your toolbox when working with individuals in addiction counseling. So, are there any approaches or techniques that do not seem to be a good or a best fit for you as an addiction counselor? And I'm going to repeat that question again because it's one of our discussion questions this week. Are there any approaches or techniques that do not seem to be a good fit with you as an addiction counselor? Maybe it's something that I talked about today. Maybe it's something that we talked about in the past. Maybe it's something that you bumped into along the way and you're thinking, I don't know if I love it. But I'd like to thank you for your time today. I know I'm throwing a whirlwind of ideas at you, and instead of trying to summarize all of them, I'd like to leave you with a quote from Carl Rogers. Sometimes, when faced with so many treatment options, it's difficult to know which one to choose. But as long as you're embracing the relationship and in awe of the journey, you're on the right track. Thank you so much.